Hello, thank you for being on time for your next session with the Beverly Hills Shrink. Before we start, I need to tell you that this episode is sponsored by the Time Teller channel. Superb channel, which of course is owned by my son. Just so you know, full disclosure. Well, today we have an interesting topic of almost universal interest. Erectile dysfunction. It's not a hard one, or should it be? So let's get down to business here. Erectile dysfunction. It's a problem for both men and women. Do I need to be very specific about this? I hope not, but at some point, most men experience erectile dysfunction. That's the inability to attain or maintain an erection, a firm erection of their penis. This is a disappointment to many women, although some like it. I can't quantify the votes, but let's get to the point of erectile dysfunction. What causes it? Well, first let's look at the anatomy of the penis. Besides what you already know, there are three major chambers in the penis. Two on the top on either side, one on the bottom. I'm not going to bore you with long Latin names, but these chambers get engorged with blood upon arousal, and for physiologic reasons, the blood is held in to the penis by valves and fibers of tissue. I know I'm speaking to brilliant people out there, but I'm trying to make it simple because otherwise I have to remember a whole bunch of things I don't really want to have to remember all the time. When these valves become deficient or non-functional, the blood cannot be held inside the penis and leaks out. Hence, you get a soft or non-existent erection. This disappoints some ladies and really upsets a lot of guys. The physiology is interesting. The anatomy is interesting. For example, both the sympathetic and parasympathetic nervous systems, both parts of the autonomic nervous system, are involved. One in erection, one in ejaculation. But that's as much as we need to say about that because those things are not what we're talking about. What are the causes of erectile dysfunction? They are numerous and overlapping at times. Age, high blood pressure, diabetes mellitus, trauma, lack of interest or stimulation, medications, low testosterone, high estrogen, depression, exhaustion, alcohol, drugs, and numerous other factors. So there isn't one particular thing that causes erectile dysfunction. Often more than one factor is at play to a variable degree, resulting in that problem. Continuing on my list of potential causes for ED, or erectile dysfunction, which has several other less nice names, but psychological factors, anxiety, performance anxiety, estrogens, medications. One medicine that is actually a big culprit that's not understood by many people who take it is finasteride. Finasteride is a medicine that's used to promote hair growth in men who are going bald. It blocks the variant of testosterone that's involved in affecting the hair follicles and causing them to lose their hair. It can also cause them to lose their erection. Finasteride. It's also used for prostatic hypertrophy, benign prostatic hypertrophy, BPH. It's one of the prescriptions tossed off by urologists without much concern about effects on the family. There are numerous other factors. One of the big ones is performance anxiety. It's one of these circumstances where if you think about it or worry about it, it's going to happen. And if it happens a little bit once, for any number of reasons, you had too much to drink, you're exhausted, then you start to obsess about it and worry about it, and it gets bigger and bigger and bigger and bigger and bigger until it happens. Prostate and other genitourinary surgeries can cause this. One of the most common problems after prostatectomy, radical prostatectomy, is impotence and erectile dysfunction. That's nobody's fault. It's not the doctor's fault. It's not malpractice or bad surgery. There's a lot going on in a little space down there between your legs. And it's easy to not get a little fiber of nerve free and you've got a problem. Well, this causes a lot of turmoil in relationships, in marriages. Women think the man doesn't love them anymore, isn't interested in them. And the more that builds up, the harder it is for the man to get hard, because their performance anxiety mounts and mounts and mounts and mounts. Are there treatments for erectile dysfunction? Yes. Some of them work, some of the time, none of them all of the time. One of the simplest, without getting fancy or pharmacologic, is change of scene in routine. If a couple's intimate life, sex life, has become boring, predictable, and redundant, and not terribly stimulating to one or both partners, a change in the scenery, a vacation, spontaneity in a strange place, particularly a risky place, might do the trick, might help them get to the point of a good result. I don't need to elaborate upon this. I think you're smart enough to figure it out. If you increase the novelty of the situation, let alone the novelty of the partner, things will work better. Biologically, weight loss and the control of diabetes and blood pressure. Obesity per se is a problem because when a man becomes obese, there are changes in testosterone and estrogen levels, and the elevated estrogen and the effect on the TE ratio, the testosterone-estrogen ratio, can be enough to cause a problem. While technically, the testosterone levels may seem to be normal, most doctors don't bother to check the estrogen level before and during and after. And so that elevated estrogen that occurs in obesity in many men is enough to dampen things down. Diabetes mellitus, high blood sugars, are a scourge on modern society. With increasing obesity, decreased activity, changes in diet, obesity is on the rise. And diabetes, with its effect on microvasculature, the tiny little blood vessels that it obstructs, as well as its contribution to high blood pressure, can cause problematic erectile dysfunction. So the sooner and the better that you control high blood pressure, obesity, and diabetes, the better off you are. The better off you are in every conceivable way. Medication. Medications prescribed for benevolent therapeutic purposes can have many side effects. There are numerous categories of medications that contribute to this. Not just hormones and hormone blockers, blood pressure medicines, psychiatric medicines, many categories of medication. Anti-anxiety medicines, anti-seizure medicines, sleeping pills, waking up pills, across the spectrum. What happens is that many times a patient is being treated for diagnosis A with medication B. And in terms of informed consent, the doctor goes over the most common side effects, A, B, C, D, E. Down at the bottom might be erectile dysfunction or sexual dysfunction, but that's maybe statistically low for that medication, so the doctor doesn't mention it. The doctor might not even know it. He hasn't read that far down the list. So the man starts to have problems with sexual dysfunction from a medication that he thinks, and the doctor thinks, doesn't cause it. Well, that needs careful perusal. Go down the whole list. And if it's a possibility, get rid of the medication. Try something else. What other treatments are available? Well, there are surgical implants. There's two major varieties of that. One is a permanent, erect, relatively stiff implant that keeps the penis erect all the time. And it can work for some people. They're comfortable with it. There's another that's a penis pump. There's a balloon-like instrument implanted in the penis with a pump in the scrotum. Be pumped up and then pumped down. And as weird or strange as these things may seem to You out there, the people who use them and get good results are very happy with them, male and female. Non-surgical. Well, one of the first ones were rubber bands or rings around the penis to hold the blood in and maintain the erection. That works pretty well. It makes ejaculation difficult, but it's certainly pleasant for the woman while it's working. Ejections into the corpus cavernosum. Sounds a little icky, but it works. The 2 injections on either side of the penis into the corpus cavernosum causes erection for a variable period of time. You can have a good time. I'm not familiar with how often those can be used or how often they are prescribed, but it's one of the choices. Amyl nitrate. Amyl nitrate is a medicine that's used for cardiac patients, heart patients, that has a big popularity, a large popularity as a drug of abuse called poppers. Well, I'm not recommending this. I'm simply identifying it. I don't recommend it. It's dangerous, but it can help affect and sustain an erection for a period of time. Testosterone. There's a problem with understanding testosterone levels in men. The range of testosterone, normal testosterone, in an adult male is something like, and I'm just going to round these numbers off, something like 300 to 1200 units, a very broad range. So most men don't have their testosterone levels checked routinely or at all until there's a problem. So if you're 50 years old and your level is 398, and 300 is low normal, is a cutoff, many doctors will, oh, your level is still in the normal range. Well, when you were 18, it was 1200, and it drops successively every year until it goes below a threshold that's independent for every man, and all of a sudden, there's not enough testosterone there. Functionally hypogonadal. They don't have enough to make everything work. And there's too many doctors out there who say, I'm not going to give you testosterone, your level's still 450. You need some careful examination there. On the other side, there's a lot of doctors who prescribe testosterone to anybody who asks for it. That's not good medicine. So there has to be a practical, realistic, honest, clinical understanding of this matter. Because if things were working well through your 40s into 50s and all of a sudden it's not working so well, and you don't have a lot of other risk factors, you're not diabetic, hypertensive, obese, you're not taking a bunch of medications, you don't abuse drugs or alcohol, and it's not working as well. And for the first time you get your testosterone checked, and it's below 500. Well, we know it was higher when you were younger, and there's not a lot of harm in getting your testosterone to 600 or above. If my patients are below 600 and symptomatic, I work with an endocrinologist to get them 600 or above. Now that's arbitrary. They might need more, they might need less, but they're symptomatic for no other reason than a potential low testosterone. Medications besides amyl nitrate and testosterone. Well, most people have heard of the group of medicines Viagra, Levitra, Cialis. These medicines work very well for many, many men, with a low incidence of side effects if you use them as prescribed. If you use them not as prescribed, taking too much at once or too often, you could have some very serious side effects. So this has been today an overview of erectile dysfunction. I hope we made the necessary points and gave you something to think about. If any of these elements impact you, sound like it might be a cause of your problem at home, then go talk to your doctor. And if your doctor just poo-poos you, get a second opinion, particularly from a hormone specialist, an endocrinologist who's free-thinking. Why do I say that? I know a very eminent endocrinologist, no names, no locations, who said to me bluntly, if Below normal testosterone is 300. If the patient is not 299 or below, I won't give him testosterone. Well, technically, I guess that's correct. That's kind of like saying, well, the patient's unconscious and they're still breathing and there's a pulse, so why should I do anything? You follow me? So maybe there's room for a little more flexibility than that approach. I hope you benefit from today's elucidation of erectile dysfunction. Please like, comment, and subscribe to this channel. And remember, please be on time for your next session with the Beverly Hills Shrink.